guys, welcome to the Pulling Curls podcast. Today on episode 162, I am answering a question I get a lot. Pooping at delivery. Let's untangle it. Hi, I'm Hillary Erickson, the curly head behind the Pulling Curls podcast, Pregnancy and Parenting Untangled. There's no right answer for every family, but on this show, we hope to give you some ideas to make life simpler at your house. Life's tangled, just like my hair. Today's guest is probably familiar to a lot of you. She is over on Instagram at mommy.labornurse. She has a birth course. She's just amazing, really simplifies birth and makes it fun. I want to introduce today's guest, Liesel Teen. Do you feel prepared for your delivery? In just 3 short hours, you can be prepared for the confident, collaborative delivery you want. You'll know what to expect and how to talk with your healthcare team, and there are no boring lessons in this class. I'll use humor, stories from my 20 years in the delivery room to engage both of you. I love how Alyssa told me that she found herself laughing at things that used to sound scary. Most of all, you guys are going to be on the same page from bump to bassinet. Join the online prenatal class for couples today. You can save 15% with coupon code UNTANGLED. You can find the link in the show notes. Hey, Liesel, welcome to the Pulling Curls podcast.
Thank you, Hillary. Thank you so much for having me.
Such a great topic.
Yes. What are we talking about today, Hillary?
Poop.
Woohoo! Poop.
Which honestly, I started my career in pediatrics. You did too, right?
Well, it's funny. Not a lot of people know this, but I was an LPN before I became an RN, and I did work. Yeah, I did work at a pediatric office for about a year while I was finishing my RN. I got my associate's degree RN, and then I worked in the ER for about a year, and then I transferred to labor and delivery, and I've been there for about 8 years or so.
That's so funny. I worked pediatrics in a pediatrician's office also. So, yeah. I mean, I talked about poop with moms all day on the phone.
Yeah, it was fun. Fun times.
And then I worked geriatrics.
Oh, really?
And boy, oh boy, do you talk about poop a lot with those people.
Oh, there's a lot of, yeah. It's funny because moms and the elderly are some of the few communities who are those are the communities that are most obsessed with poop. For sure.
I would actually give the vote to the old people because they had first you need to heat up the prune juice in the microwave for 45 seconds. They're not a minute, 45 seconds.
Wow.
Then you need to add the milk of Mac. Wow. Then you're going to stir it 6 times, not 10 times.
Oh,
and I'd be
hey, you know what? If I don't have a job and I just want my body to be working good, I probably would be all obsessed with my bowel movements as well. I mean, hey.
I know. Well, and they're in I was nursing home. So that was literally all they had to focus on. So yeah, this intro is really here to let you understand that nurses, my first day in the hospital and nursing school, just poop everywhere. And I just thought, is this really what I want to do? And then I was like, yeah, okay. Yeah, I'll do this.
Yeah. I have a story. So when I was I promise we're going to start talking about poop regarding pregnancy. But when I was in LPN school and I was doing my clinical at nursing school, and yeah, there was this lady that we were just cleaning up, and she had a turd on the side of her bed rail that was cold and had probably been there forever. And we're turning her, and I'm like, is that poop? And the other girl was like, oh my God, how long has that been there? And we're both like, where are we? It's oh God, there's poop everywhere.
Yeah, there really is. So as a nurse, all nurses go through training where poop is all the things. In fact, there's a thing called a colostomy where you poop in a bag. And that was what I did when I was pregnant with my first. I had a patient that had that. And literally, I would rather do that than to suction the trach patient that I had down the hall. So
100%. I agree with you there, Hillary. I am not a respiratory person. No. Hats off to all the respiratory therapists. If any of you guys are listening, we love you. And we do not want to do your job. And I know you don't want to do ours either.
Yeah. So it's just we've picked which areas we're okay with and which areas we're not.
Which zone.
Yeah. I would do the coloscopy. What is it called?
Colostomy bag.
Colostomy bag. And then I would go down the hall. I'm 9 months pregnant and I would dry heave every time I checked in the drink.
Yeah. Oh, I'm sure.
So pooping at delivery.
Yeah.
Liesel, does it happen?
It happens quite frequently. And it's, we're just trying to normalize it. I mean, gosh, like, I don't know if there's any studies that have been done on like what the percentage of people who poop during, while they're pushing, having a vaginal delivery. But I would say it's probably like somewhere in the 60-70% of patients, maybe higher. I mean, really, what I tell people is like, the way I normalize it is think about where your vagina is and think about your rectum and think about your baby's head coming through your vagina, and that baby's head is pushing on your rectum. So like anything that's in that rectum is going to come out. It's going to come out.
Yeah. And you only have big muscles down there. It's not like where your fingers, where you can move your index finger, but not your middle finger. It's like one big muscle. So you are pushing, and everything that's south of your belly button is going to come out.
Yes, exactly. And I also like to remind patients too that if you're pooping, it's usually not that you're pooping like like when you think about you're pooping, it's a lot, like you're pooping, right? It's usually not that much. Sometimes it is, sometimes, but it's usually just a little bit kind of here and there at the end. And honestly, I know we're going to get into this, but we like poop.
I know.
We like poop for some good reasons.
Yeah, because I would have patients be like, am I pooping? And I'd be like, yes, and I love it.
Yes.
Right?
Yes.
Because I know you're actually pushing. Because some people just squunch up their face to push.
They use their face muscles, I know, or they use every other muscle in their body besides the muscles that they're supposed to be using.
Right. Because when I show a patient how to push, I squunch up my face, right? I mean,
Yeah,
I'm verbalizing like where you're going to push, but there's no way for Liesel to know that I'm like pushing right now.
Yeah.
Because it just doesn't show on my body unless you make the pooping face.
Mm-hmm. Mm-hmm. No, you're exactly right. I know. And that's some tips that I give people too is like, okay, I see that you're pushing in your face. Like try to relax your face, try to relax your other limbs, and just think about pushing like where that baby's at. Like push against that baby.
Yes. Sometimes I'll even do the whole like horse thing.
Yes.
I'm sure this is great for podcasting.
Yes.
Where you just relax all those muscles.
Mm-hmm.
And also I have seen moms who push just in their face and then they like burst blood vessels in their face.
Yeah. They get petechiae all over. Yeah.
Not great for the next day photos.
Yeah, I guess we can edit some stuff, but yeah, I know it's just unfortunate. They get blood vessels like in their eyes broken. Yeah.
Yeah. Which is why you got to push in your bottom, right?
Yes.
So let's just pretend like I'm pushing and Liesel's my nurse and I poop. What do you do, Liesel? Do you just start screaming?
Yes, I'm like, you pooped. I can't believe it. No. Usually what I do is, first of all, I will read the room. If we have had the poop conversation already, and like I've had some patients where they're like, am I pooping? Like it's just we're talking about it and it's funny and like we can just talk about it. I would say the majority of patients are not like that. And the majority of patients, I just, as they start pooping, I don't even say anything. I just get rid of it. It's like a clean sweep. There's a pad underneath them. I just kind of tuck the pad and kind of just get it and roll the chucks kind of underneath them and pull it out and then say, okay, I'm just going to put a new chucks underneath you. And then you just get rid of it and throw it in the trash can.
Yeah.
It's just like we're secret agent. Get the poop away really fast and nobody needs to know.
Right. Now, there are some people that it's just like a continual flow. So
yes. Yes.
Again,
yes.
I don't care. There's
care.
so much that I'm like doing while you're pushing. We're looking at the monitor. We're like making sure you're not swelling. We're like thinking about, do we have everything in the room? So it's just like part of that whole like
it's process. It's part of the
poop
process.
away. Make sure I have Pitocin in the room. Make sure. Yeah.
Yeah, it's part of the process. And yeah, you're right. Some patients, they do just kind of keep pooping and it's not just a one-time thing. And all we can do is just clean it up as fast as we can. And if they ask, we say, yeah, you did a little bit, but like, it's fine. You're pushing right in the right spot. And sometimes, they will say something about the smell and we'll just we have coffee grounds on the unit just in case we need to put some coffee ground. That does help a little bit with the smell. But you know what? It is. I just kind of glance over it and I'm like, yeah, it's whatever. Just
keep pushing.
It's a
just
really
keep
good
pushing
thing
because I want to get out of this room.
Exactly. I'm like, the poop is good. It's no problem. But if nobody's saying anything, I just clean it up and I just you're right. It's just part of the process.
Yeah. Now there is one guilty party in this whole thing. Sometimes dad's like, oh my gosh. And at that point in time, I look at him like daggers are coming out of my eyes that I'm like, we are not discussing this ever again. Ever again.
Yes. No. Yeah, I agree. Like sometimes the dads or the partner, like they'll look down and they'll be like, and I'm like, no, don't say anything. But sometimes they do. And then it's sad because it like makes the mom more embarrassed. And I'm like, no. But then I just have to reiterate that, you know what? Yeah, but it means that she's pushing in the right spot. And guess what? Like usually when you're pooping, you can kind of almost see the hair of the baby. So we start talking about, oh, look, I can see baby's head. And I kind of put a little chuck where the poop is. So we're looking at the baby's head instead of the fact that we're pooping. We kind of just change the subject a little bit.
Yeah. So it might be a good thing to just tell your partner it might happen and just keep your mouth shut. Like the nurse has got it.
Yes, exactly. Yeah. And that's why I encourage partners to always look in on birth education because they need to know what to expect as well. Because yeah, I think if I wasn't expecting my wife to be pooping and then I saw that, I would be like,
right. Because if say I was sitting on the couch and my husband looked over.
Yeah, exactly.
I would expect him to say something.
Yeah. But I think when you explain it like anatomy wise, like, okay, this is legitimately what's happening. Like it has to come out. If there's anything in there, it has to come out. Okay. Your wife is about to birth your beautiful baby. And this is just part of the process. I also tell patients, moms, anybody who is afraid of pooping that, hey, you know what? I've never had anybody get divorced after their partner sees them poop. Not that I know of, at least. I've never had anybody say like that was the reason I got divorced because my partner saw me poop during delivery and we just got divorced over that. It's like, it's going to be fine. You know what? It's going to be fine.
Well, and I think there's so much more trauma over the partner seeing that area in general. Like their playground area is is being bulldozed basically.
Yeah.
So there's just a lot going on. So a great thing to talk about with your partner in advance, ladies.
Yep.
Just have them listen to this episode. I bet they'll love it. They'll literally just love it. Yeah.
I bet they will too, because you know what, guys, and obviously your partner doesn't have to be a guy, but like if guys are gross, like they like poop. So hey, they might be into it. I don't know.
Yeah, they could very well be in the potty humor stage that my boys have yet to leave. And one's 21, almost 22.
Yeah, my oldest one is 5 and he's starting.
He's getting there. That's exciting.
That's not very nice for me to hear that you have a 20 and 21-year-old and that's not going away anytime soon. Okay. Got it.
He might. I mean, he probably I don't spend a ton of time with him, but I will say that the 18-year-old that's going to college definitely would find all of this very funny.
Yeah. Mm-hmm. Cool.
Yeah, it's great. Okay, so the one thing I do think that can help you not poop is to not be induced, because I think our bodies naturally clear out that thing. So that's my one caveat. If it's like a huge deal for you, which is not a big deal for anyone else in the room, which is all you should really care about, right? Because that's why I don't poop on the couch, because I would have to clean it up.
Right.
And the nurses are going to be the ones cleaning up, and we are 100% fine with it. It's just what So, okay. So pushing, let's just give a few pushing tips in general. I think we've talked about it. Don't push in your face, which we see a lot of people do.
Yeah, I always tell people, regardless of if they're on their back or their side or wherever, try to tuck that chin to your chest and kind of curl around baby. I also talk about like pushing as if you're pooping, and that is a good idea. Usually, like some people want to push more and use those deep core muscles, and they're doing that open glottis pushing, and that's a little bit different. But especially with my epidural patients, I say, you know what, you're gonna take a big deep breath in and hold it like you're going underwater and push, like you're pooping, and that gets them to kind of understand the process. I also give the tip to, I think we talked about it a little bit, but to not only relax your face, but like relax your other limbs too, relax your legs, and really just use those muscles down there. I have a lot of patients too, you probably have seen this, where they'll be pushing on their back or kind of on their side, and they're holding their legs and they're like digging their arms into the bed and like kind of doing, this
kind of like the
back.
Exorcist. Yeah.
The Exorcist. Yeah. And so I'm like, get the chicken wings going. You got to bring your arms up, because if you're digging your arms back into the bed, you're like releasing that energy back there. So get your arms up like chickens and curl around your baby. And if they are pushing on their backs, I tell them, not only curl around their baby, but like push up to the sky. That usually gets them, because it's kind of like you don't want to push. It's almost like you don't want to push out, but you want to push like underneath that pelvic bone. And like when I say push up to the sky, they're like, oh, okay. That makes sense.
Yeah, we aim for the birthing lights.
We aim for the birthing lights.
Yeah.
Exactly. And another tip too is, change positions. If you're not liking this one position that we're doing, like it's totally okay. Let's go on your side a little bit, or let's do some hands and knees. Even if you have an epidural, it's safe to do a lot of, these positions. The only one I don't want you to do really is to stand up and get out of bed and get in the tub or anything like that. But like you can get on hands and knees typically if you don't have a crazy, crazy dense epidural. So yeah, try to change positions, especially if you're not making a lot of progress. If you're making progress, like cool, keep doing your thing. And then another tip I'll say is you probably say this too. If you're watching the monitor, try not to push too early. Okay. So like try to wait a few seconds and let that contraction really peak. And then you start pushing because you're using most of your energy on that first push. And I want that one to be the good one. And I want that one to kind of start at the peak instead of, you're kind of tired by the third or fourth push. And that's when it's kind of peaking. So sometimes I'll do that with patients too, if they're having a little bit of trouble. And then my last tip is rest in between those contractions. Okay. Just rest.
Yeah.
Don't worry about anything. Don't worry about the next contraction that's coming. Like just take that time and just breathe and just rest.
Oh, I love that. Get your ice chips in because your mouth can get a little dry with all the breathing, or just a sip of water, or vodka.
Or vodka.
Just kidding. Don't bring the vodka.
Don't tell us about it. I guess you can pack it.
Yeah. When you were saying to relax everything, I think I had a lot of patients who would push and then clench their Kegel muscles.
Yes.
And I'd be like, no. The Kegel muscles are not even invited in this room right now. So just keep and a lot of times those prenatal yoga classes will have times where they're like, practice relaxing your pelvic floor. And I was always like, this is stupid. Okay. My problem is contracting my pelvic floor, especially after baby number 1. Right. But it really is helpful if you just take some time to just like free for all down there. It is just relax. That's how you want to push. Because it's harder than you think. And I think a lot of times people get nervous because we're all staring at their baby exit area. And so they're like, don't.
I know.
Because once you've seen one vagina, you've seen them all, really. I mean,
you have. I don't really remember many like that really, really completely stick out. Like they all kind of blend together, and you know what? It is what it is. I will say too, forgot about this tip. If you're some people are into it, some people aren't, but we have mirrors that we can put up for you so you can kind of see your progress. And a lot of times that really helps people, especially if you've got an epidural and you're having a little bit of trouble pushing with that epidural, because sometimes you can. That can kind of help you see the process a little bit better, because when we push, typically, and happens more with first-time moms, typically they have to push longer, but this baby, I kind of explain it like it's going 2 steps forward and 1 step back. Okay. So like your uterus is pushing down and you're pushing and that baby's coming, and then your uterus stops contracting and it relaxes and that baby kind of goes, sucks back in. And we want to do 2 steps forward, 1 step back until we kind of get to this point where baby's kind of like, oh, okay, I can't go back anymore. And then we just keep going, and then you have your baby.
Yeah. And you might be like, no, mirror, do not want to see it. And maybe you don't.
Yes.
But sometimes they'd be like, I really don't want to, but do you think it would help? And I'd be like, I mean, we can just bring it in here and then I can kick it.
Yeah.
Like if we're hating it.
We have ones they like, you probably have the ones that move, and I'm like, we can just tilt it up. If it's fine, we'll get it in here. If you don't like it, we'll just get rid. Yeah, it's fine.
And another thing that's helped a few moms, not very many, a lot of do not like this idea, is to touch the baby's head. So if the baby is crowning, a lot will be like, can I touch it? And that helps them realize that they are making progress. But I will say a lot of moms are like, no, thank you. Yeah.
Yeah, I know. A lot of times too, so I'll turn on the delivery light so it's nice and bright down there, but it's not like bright in their face.
Right.
And once I start seeing baby's head and maybe I'll see a little bit of hair, I'll say, hey, Dad, you want to look down here? Like, look, you can see. And then this dad starts to get excited, like, oh my God, that's the baby's head. And then mom's like, oh, where, and we get excited. So it's just like little things like that to encourage them. Because sometimes, especially with first time moms, I mean, you can be pushing hours and you're like, I feel like I'm not even doing anything. It's just,
I know you feel like you're pushing that baby from the North Pole.
You do. I mean, sometimes you are, but yeah, it can be discouraging after, a couple hours and you're like, wait, am I crowning yet? I'm not even crowning. What?
Right.
So yeah, it's just about, I like to change positions a lot. I like to have, kind of dad look down there. Like you said, make sure you have some ice and some water, keep you nice and hydrated. But yeah, we can touch on that too, that like, hey, pushing for some people, it's one push. For other people, it's hours and hours of pushing. So I always tell people expect, kind of the worst case scenario that you're going to go into this pushing for a long time. And if you are one of those that is not, then like, hey, great, awesome. You have exceeded your expectations.
Yes. Yeah. Average pushing time, I think, is 2 hours on your first, they say.
Yeah.
And don't be afraid to be like, can we just take 15 minutes off?
Yes.
Your nurse is not going to be sad about that either. Because she's probably thirsty, would like a pee break. Yeah.
Yeah. Because we stay in there the whole time with you. And your provider typically, it depends on the practice that you're in, obviously, and the provider. But providers that I work with, typically in a hospital setting, yeah, your nurse is going to be with you the whole time when you're doing that 2 steps forward, 1 step back kind of situation. You're pushing this whole time. And then once we kind of get that indicator that, oh, baby's to that spot where baby's not going back, back much anymore, then we'll call your provider in. And it's usually not too long after that your baby's born. But yeah, we're with you the whole time. We're not, leaving and coming back and letting you push by yourself or anything.
Yeah. Sometimes I'll run out of the room and be like, oh, I forgot the pit. I'll be right back.
Yes.
I'm not leaving
in
you
between
at
a contraction. Yeah.
Where the baby's going to fall out. So I'm like, push if you want. If you don't, take a break.
Yeah. You got to read the patient and really,
Yes.
like,
because sometimes they start to freak out. They're like, you're leaving? And I'm like,
yes. Or like, hey, if this is my 3rd or 4th baby and I'm like, I'm probably not going to leave the room.
I'm going to call out for that pit.
Yes.
And like Liesel said, don't plan. If you have midwives, a lot of times the midwives will hang out with you and push.
Yeah.
But OBs do not. In general, I did have one doctor who would get angry if I pushed before she got there.
Yeah.
But and honestly, they're not very good at it.
I would agree with that.
It requires a lot of patience and a lot of like cheerleading, and that's just not their skill set.
No, and they have a lot of other stuff that they're doing too. Typically, there's a lot of patients that they're taking care of, and you're our only patient, so we're in there for the long haul. They have, maybe surgeries they have to go down and check out. It's just they have stuff, so it's like, yeah, they're not, like you said, midwives are great. I've worked with some midwives before, and they'll stay in there and just be in there the whole time. But yeah, I would generally agree that most OBs kind of come in at the last bit. Not to say, that's just the way they know, and they can be great OBs, but that's just kind of how they are.
Well, and you got to think we each have our skill set, because I'm not great at sewing up vaginas.
No. Me either, Hillary. I didn't learn about that in nursing school.
In fact, I've never sewn one up.
No, nor have I.
Just to clarify, in case people are like, Hillary, what are you doing on your free nights? Nope.
Practicing my crocheting on little.
I can tell when it needs it.
Yes, I can too. Now, again, it's not really in my skill set, but yeah, I can tell if somebody's going to need a repair for sure.
All right. This was awesome. You guys, if you have any questions about pushing or if something's not working for you, speak up, because a lot of it is just you and your body. I don't know what's feeling right in your body. If you're like, oh, I wish I was on my side more. I wish I was on my back. I wish I was sitting up more. You have to tell me, because it's so much like, and sometimes it's just tiny movements. Like if I just shove a pillow, they're like, oh, it's so much better. And I'm like, I don't know why. Nobody else would have wanted that.
Exactly. Or you put a little pillow underneath their head or something, or we just kind of, instead of being on their back, we just kind of shift, maybe they're just kind of having a little bit of pain right in their tailbone, and you're like, okay, let's just shift over. And then sometimes that's so beneficial, and the baby like really spins and the baby comes right out. But yeah, if you're uncomfortable, you don't have to be doing anything that we're like, I never want you to feel like bullied into anything. If you're really uncomfortable, now, of course, like having a baby is uncomfortable in and of itself, right? Like I'm not saying that, but yeah, if for some reason you're just like, oh, I just can't do this on, like I was pushing on hands and knees with both of my babies, and I'm like, dude, can't do this anymore. Like I freaking hate it. Let me just get on my back. So if you want us to change positions, if you need ice or anything like that, like speak up. We are here for you.
Right. Yeah. Because it's your body and we aren't inside of it. Thankfully. I mean, I'm not sad.
I agree with that.
I would prefer not to have had thousands of babies personally.
Yes.
No,
yes,
thank you.
Too. Done it twice, and yeah, no, I'm good.
Liesel teaches amazing birth classes. So if you guys are looking for a birth class and mine is in a good fit, check hers out. She has a natural birth class and an epidural and a C-section one, correct?
Yeah. Yeah, we do. We have 3 different kinds. So yeah, I'm over at mommylabornurse.com and then really most frequently on Instagram.
Yeah, she has an amazing Instagram channel. I'm always commenting like, this is so good.
Thank you. I have a lot of fun. Hillary and I were talking about my Barbies up here on my desk, but I have a lot of fun with all my props and do Q&As on the weekends. And we just are always coming up with fun kind of content ideas. We like to take things and, create, put it out in the simplest way possible for you to understand.
And fun.
And
do
fun.
It fun. Yep.
Yes. We don't want to make anything like super dry and boring. We don't like boring. We want you to be excited about giving birth. So yeah, definitely check me out on Instagram at mommy.labornurse on there. I would say that's where I hang out most. And then I have a podcast too, the Mommy Labor Nurse Podcast. You can catch me over there.
Awesome. Thanks so much for coming on, Liesel.
Yeah. Thanks for having me.
Okay, guys, I hope you enjoyed that episode. I think it just reminded everybody like how used to it. Hopefully it reminded you how used to it nurses are. Like at our heart, we're a nurse. We're not just like your friend. Like we've all been through nursing school that has required a lot of bodily fluids. So when you provide us a bodily fluid, it is something we are very used to. Now, if you have a trach, we're probably going to call in somebody else to fix that. We each have our own bodily fluids that we're cool with. I want to thank Liesel for coming on. A lot of my friends were like, wow, you're having one of your biggest competitors on. I absolutely adore her. And I know that my prenatal class isn't for everybody. So if you've thought, I don't know if Hillary's really my style, check out Liesel. She is a great resource. Do not miss next week's episode where we are chatting about making invisible work visible. This is a really important one for all moms, pregnant or not. So stay tuned for that one. Thanks so much for joining us on today's episode. The Pulling Curls podcast grows when you share us on social media or leave a review. If you do, please tag us so that we can share and send you a virtual hug, which frankly is my favorite kind of hugging. Until next time, we hope you have a tangle-free day.